Hi YouTubers, it's next round to be a video right now, so medical things around Big Asigar. I'm talking right now oral cancer or mouth cancer. So this is a cancer of your mouth, your lips, your gums, your tongue, or your cheeks, or the roof and floor of your mouth, or the back of your mouth. So basically this has to do with your mouth in general. Now most oral cancers are called squamous cell carcinoma, which is a cancer of the epithelial lining. Big disclaimer, I'm not a doctor, not giving medical advice. This is just general information. I am not a cancer patient. I'm going to put a disclaimer in the title below. So I'm not a cancer patient. I'm not somebody who's giving medical advice, who's giving professional advice. Don't take my videos too seriously. Anyway, so yes, it's called squamous cell carcinoma, which is the majority of mouth cancer. Occasionally you'll get a sarcoma or a lymphoma, but the majority of mouth cancers are mouth meaning oral cancer. So mouth cancer and oral cancer, depending which area of the world you're from, essentially mean the same thing: tomato, tomato, potato, potato. So yeah, they're called squamous cell carcinomas, the majority of them, about 90% of them. And treatment for them depends greatly on how far they spread. Unfortunately, by the time most of them are found, they have already spread to lymph nodes in the neck around this area, or have spread to other organs. So because a lot of times when these cancers arise, they start off as a very minor thing, like a minor sore throat, or a little sore in the mouth, or a little bump in the mouth. And oftentimes patients won't appreciate these factors, and they will kind of ignore them until the symptoms get worse. And even when the patients notice a lump in their neck, they'll think it's a sign of a cold or infection or a flu, and they'll ignore it. So early detection is really key in these cancers. Early detection saves lives. Big ass cigar of life. So yes, and the majority of these cancers are, in the past they were caused by heavy smoking, predominantly cigarette smoking, and to some degree chewing tobacco, and also heavy alcohol use, particularly hard liquor and beer. However, in more recent years, last 10 years or so, 10 to 15 years, more of these cancers are caused by HPV, human papillomavirus, which can cause cervical cancer and also anal cancer, ass cancer like the big ass cigar, and also other types of cancers of the genital tract. So more and more of these cancers are being caused by HPV, and this is generally spread by sexual contact, oftentimes oral sex. So that's how these cancers are contained. And these patients who have HPV-associated cancers tend to be younger and tend to be non-smokers and non-drinkers, as opposed to patients, and they tend to have better prognosis in general, as opposed to patients who have smoking and drinking-related cancer, tobacco and alcohol-related cancers, who tend to be much older and tend to have a more bad prognosis. And generally, the treatment for HPV-associated cancers tends to surround around chemotherapy and radiation, while the smoking and drinking cancers tend to be more around like surgery and then after chemotherapy and radiation. So success rate depends greatly on when it's found. Oftentimes, the cancers with the HPV are found much later because of the it's not very high on a doctor's radar, and also because oftentimes it presents as a lump in the neck, the first symptom, so as opposed to a sore throat. So symptoms could be a sore throat, a bump in the mouth, pain in the mouth, a white or red patch, earache, many different types of symptoms, coughing up blood even, so hoarseness, like like that, trouble breathing, many different types of symptoms, any change in the mucosal membrane in the mouth. When found early, these cancers have a very good cure rate. Again, they're usually not found early, so and a common misconception about these cancers is everyone who has these cancers is going to like lose half their jaw, and that's not true. And even if you do end up having a large segment of your face taken out or your mouth taken out, there are many types of reconstructive surgery. Over the last 30 years, 40 years, reconstructive surgery has gotten a hell of a lot better for these cancers. So there are, it is good. I mean, the prognosis nowadays, I wouldn't say is terribly better than the 1980s, 1990s, but the way to reconstruct the patient and reconstruct the face, the mouth, the tongue, the swallowing passage is a lot better nowadays, a hell of a lot better. So overall, nowadays the prognosis is better as opposed to like the 1980s when you read about people like, with baseball players getting diagnosed. So anyway, big ass cigar for life. Bye.